My name is Georginia Nwoke. I'm a registered clinical psychologist in Alberta. This is my 11th year in Calgary. Actually, I left Nigeria in 2003, and then my family and I migrated to England, the UK. And from 2003 to 2009, when I came to Calgary, we lived in the UK.
My name is Ogechi Nwaneri. My background is nursing, and it's basically nursing I've done all my years. I've worked from pediatrics to geriatrics, and I've done a little bit of mental health and acute care, emergency, whatever you can think of, right? But right now, I'm in cancer research. I work with Alberta Health Services, and I work as a tumor group facilitator. And what that means is we help front lines, that's physicians and nurses and whoever. We help them to gather and organize evidence-based recommendations for treating cancer, diagnosing cancer, and for follow-up and transition.
So my name is Dr. Lawrence Deck, and I'm originally from Saskatchewan, but I've been living in Calgary for most of my life. So I got to experience life here. I grew up here. I played football for a long time, so I played football in the States, where I went to school in California, and then I played professional football in the CFL. And in between, I started a family and finished a Ph.D. So I was born in Canada. My father, biological father, is originally from Ghana. And then my mom was originally from Saskatchewan. And so I had quite a turbulent childhood, lots of abuse. And my mom had significant mental health issues, I've come to learn. And so I ended up in the foster care system and eventually adopted.
And then on getting here, honestly, it's like starting afresh again, even though I had lived in the UK for 6 years. So I kind of started afresh. Oh my God, the first challenge was, I come from an English-speaking country, Nigeria, right? And I did all my psych training in the UK. And then coming here, you have to prove that your training or your schooling was done in English. You have to prove that you speak English well and all that, and you write English well. So that was a huge barrier. That was the first barrier that kind of hit me hard. And then coming here as well, I had to do some training as well to be able to be registered as a provisional psychologist, and then I started from there. And then initially it was very, very hard for me to kind of get into mental health, which is in line with my career. So I started the first job I did was in a grocery store, and I did that for like 8 months. So that kind of helped me to get into the system. My children came first, my husband followed, and I followed. For my husband, it was really hard. He got a job, and a few months after, he lost the job. And he found it hard to kind of go back into full-blown school to be able to get into the system, and he couldn't take it. And then he had to go back to Nigeria and trying to see what he can do to be able to financially support me and the kids while we're here. Oh yeah, it's very common. Like I said, I did my first job in the grocery store, right? I remember one day I was standing at the till and I was scanning groceries for this lady and her 5-year-old little girl. And the girl turned to the mom and said, "Mom, why is she brown?" And the mom quickly ran and kind of shut her up, right? And I said, no, leave her. She's asking from her heart, right? Because I looked at the girl and I said, this is the age of innocence. She was just being curious. And I explained to her, I said, I come from Africa, and my skin color helps me to survive the hot temperature there. And yeah, that's why I'm brown and you are white. And the mom kept apologizing, saying, "Oh, I'm very sorry." I said, "No, you don't need to apologize." She was asking from her heart. And then the next one I experienced was, that was my first winter, right? And I usually am very allergic to cold. So I started having all these itches all over my face. And I went to my doctor. The cream she gave me wasn't really working. So I started applying cream that is shea butter based, right? So during my lunch, one day I went to the washroom and I washed my face with warm water to be able to find it very soothing. And then I applied my shea butter cream. And another girl who was there, I believe she must have perceived the smell of the shea butter. And then she reported me to the manager that I was smelling. And then the following day I came to work, all dressed up, wanting to go to my till to start the day. And the manager called me and said, "Oh, I learned you were smelling." Started educating me on how I had to have my bath well and all that. And, but I just smiled through all that because I didn't want to be sucked into that negative energy, you know. No, I wasn't prepared for that. So after he finished, I said thank you because I knew that wasn't my bus stop. I knew I was just passing through to get into my career, so it didn't really bother me much.
I came into Canada late 2011, and I came straight from Nigeria. Actually, my husband was here, but that wasn't primarily why I came. I came on invitation from Mukana, and I came and did my Psych assessment, and that's it. I entered into nursing. Yeah.
And did you come by yourself, or
I came by myself actually.
Okay. And how was that transition?
Okay. Initially, it was a little bit of not knowing. It was full of unknown. It was full of I wouldn't use the word confusion, but it was not really knowing what to expect. You know, I practiced nursing for more than 8 years back home, and that nursing was different, right? It was in a different environment. It was different epidemiology in terms of disease and everything, but the actual principle of nursing remained the same. So when I came into Canada, my focus was, you know, I had to get into my profession, and that journey, it wasn't it wasn't that straightforward, but thankfully there were lots of support because my husband was here, and then he was able to. But having that support system, I think that was the biggest thing, because there were lots of, you have to write the English to get into Canada, and then the Psych assessment, and then the schooling, and then writing the board exams, and then after the exam, the biggest journey was actually getting a job in my field, in my profession, and going into my practice, right? So yeah, that was one of the biggest challenges. When I was looking for a job, a lot of people told me, and I think I did that. I attended a couple of seminars here with newcomers, you know. And I said, oh, you know, you have to, you can't write your name directly because my name was very ethnic, Ogechi, Nwaneri. They said, oh, you have to make it a little bit English. Like just take out the Ogechi, put J, like OJ. So it's easier when people see your resume, they can call you right away because it doesn't sound so ethnic. That was one. So like getting to get that first job as an immigrant, like getting to get that first professional job as an immigrant, it wasn't easy at all, right? And again, people want the Canadian experience, which, to be honest, to be fair, it wasn't that easy because I have to work to get the Canadian experience. But that was the first thing. Everyone wanted the Canadian experience, right? So thankfully, I did my practicum here, and somehow that was able to serve. And it was easier to get in from the remote areas as an immigrant. That's what I had. That's what I was told. And somehow I tried that, and I didn't like that, and I didn't do it. For me, that didn't align with my values. I felt I felt it was beyond uncomfortable. It was something that challenged my value. It was something that challenged who I am. It was like I was trying to change a part of myself, and that's not that didn't sound right. So I didn't do that. But a couple of my friends told me they did. So what a couple of people said, they actually changed their names to get in. But what happened that during the interview, people were shocked to see a different person because they were expecting somebody different based on the name, right? And they're here seeing somebody different. So it was a lot of shuffling here and there. So I didn't feel right at all.
I was initially going to go into teaching, and so obviously I was on a football scholarship in California. So you're going to school and playing football, and I was going to go into into teaching, but I got connected with a program called the Summer Bridge Program. So it's a program offered by the university for minority students. And so the idea behind the program is they provide you an opportunity, if your grades weren't quite high enough, to do summer school classes and experience what university would be like. And if you complete your math and your English, then they will provide you with admission to the university. So it kind of gives minority students a little bit more of an opportunity to get into university if they didn't quite do well enough academically. And so I was involved with that program for a couple of years and really fell in love with the idea of counseling and psychology. And so I knew that, a football career is a relatively short window. And so it was going to be important for me to have a backup plan. And so while I was playing football, worked on my master's degree, and then later started my Ph.D. Because of that program. Yeah, I would say that my experience was different because I was adopted into a white family, and so I grew up in a white home. I grew up Northwest Calgary. I cannot recall any black teachers. My high school of 1,700, there might have been less than 20 black students. I want to say that's even high, that number that I just gave you, maybe 15 of us. And so I didn't have a lot of enrichment. I didn't have a lot of opportunities to interact with people of color. And so really my eyes were opened when I went away to university in California. And so there I kind of, there's lots of black students, really got enriched with what it was meant to be black. So back to your original question, my experience was very different. And one of the challenges with my experience is that, and I think with other people of color as well, is that the places where you see how to be black is basically in the media. So movies, videos, sports. And so I gathered kind of my idea about what it was like to be black off of these things. And unfortunately, what you see or what is depicted is, gangsters. So you think about the old school movies when I grew up, like Juice or Boys in the Hood or Menace to Society. Like these are the movies, the black movies that were out. And so that's kind of what you get. And then you have the other side where the other movies that have black actors in them are all black actors that are kind of rescued or saved by people like Caucasian people. The Blind Side. What's the baseball movie? Hardball with Keanu Reeves. All the football movies have white coaches. And there's other movies as well. And so that's kind of the perception that you get of yourself is either you're this gangster or you're going to get saved by a Caucasian person. And so really that's where my experience came from. And it wasn't until I moved to the States that I started to see things in a different light. So yeah, there's lots of racism. I think that in Canada it's more under the surface. We don't see it. It's more built into the system. But I experienced, multiple things when I grew up. So on my graduation day from high school, there was a big fight, and I actually tried to stop the fight from happening, and somehow I ended up in the paddy wagon. I'm not quite sure how that happened. I went to my, a little bit later in life, I went to my best friend's wedding party, and one of his wives to be, one of their family members called me the N-word. And so you see these things happen in your life, and really as a young black person, you don't really know how to navigate that.
The mental health in our community is really, really getting much because a lot of people from our community, especially those of them who come in as refugees, there's a lot of trauma in those families. Like I said, my husband had to go back because he couldn't find his feet here. A lot of those families as well, the fathers in those families have had to go back to be able to see what they can do to support their families. So you discover that the mothers are left with the children. And then sometimes as well, you see that these children might be 5, 6, 7, and 8. And then this woman is juggling with raising the kids and trying to find her feet as well. And usually there's a lot of poverty in these families. And what happens is that most times the first 2 kids, step into that hero role in the family. They had to go to work to support their mom financially. And sometimes these kids, when they see the level of poverty and the level of suffering that their mother is going through, they have no choice than to get into crime. I see a lot of depression in families, even amongst the children. I see also a lot of PTSD, post-traumatic stress disorder. I see a lot of them experiencing triggers with people, places, and things. I see a lot of postpartum depression as well, because you see that most of our migrants as well are young families, right? They have kids. Back home, it takes a village to build a family. It takes a village to raise a child. Back home, when you have your child, your mom is there, your mother-in-law is there, your aunts are there, bathing your kids, helping you. But here, basically, is me, myself, and I. This community is you're so isolated that you have no help at all. So you see the young lady with a newborn trying to bath the baby, trying to raise the baby, and she has no support at all. So a lot of them, get into depression. A lot of them get into postpartum depression as well. But the problem we are having is that a lot of us are refusing to seek medical help. Because you're raised from a culture where you're not supposed to talk to strangers, right? No, you don't trust strangers. So they find it difficult to get mental help. I think that they are supportive to the extent that we let them in. Most of the time we discover that we push them away, right? But what I going forward, what I foresee is that it will really be very supportive for us and our people if the government and the agencies can support grassroots organizations. Grassroots organizations like Real Me. There's nothing stopping us from duplicating Real Me in the 4 quadrants of the city. There's nothing stopping us from starting programs like Real Me that will go into families and support these people, because they're not going to trust strangers. It will be very nice to use the people to be able to help themselves. Oh, yes, that cultural awareness, cultural sensitivity, is very, very important. And the thing is that most of our mental health workers, are also social workers that work with these families, are doing everything to be able to also understand the culture, which is very good. Yeah. And for these families as well, like I've talked about, fathers going away to be able to see how they can support their families. What I see again is that father figures are missing in most of these families. And it would be nice to have grassroots organizations that will be able to raise mentors. There is nothing wrong in a white, strong male mentoring a black kid, right? Cross-cultural. You teach me your culture, I teach you my culture, right? There is nothing wrong with a Latino man mentoring a black kid and vice versa. So through that way, we're able to build up that trust within our community. But what I see is that there's a lot of fear. A lot of people are afraid of us. Basically, you don't need to fear me until you get to know me, right? And some people I work with who are from the street, how they define fear? They say, F everything and run. So we can't continue to F everything and continue to run. Because the more we run, the more these communities feel that we are not supportive of them. And they are raising children and young people who are feeling that this environment is not supportive of them. So we need to kind of support grassroots organizations to be able to rise up and, work with these families. Governments can focus on legislation and policies. Put funding in, support grassroots organizations.
When I came into Canada, when I came in, what I read about was that Canada is a post-racist society. There's no racism in Canada. It's a place where everyone is treated justly, fairly, and equally. So that was what I had, and I believed it. In fact, I drank it, right? So I carried myself like everything is going to be equal, everything is going to be just. And partly, somehow, whether looking back now, there were lots of biases, lots of cultural biases that I saw while I was going through the process of getting my licenses, but I didn't actually pick on them because that wasn't where my lens was. Okay, and partly because I did very well in school, so that wasn't an issue at all. So my actual first experience of racism was when I was at work, and someone told me, "You can't touch me without black hands." And that was my first time. I was like, I didn't even know my hands were black. I was like, what's this? And she kept on saying that, right? And before she said that, prior to the time she said that, when I would come in to give her care, she acted as she was almost very aggressive towards me, but I didn't really interpret it that it had anything to do with my color or my race or anything. I had no such knowledge until she said that, and I had to ask again, what do you mean? And she said, in fact, you can speak English so I can hear you. And I was speaking English, right? I stood there, I just went out, and because I have had this impression, this knowledge that Canada is a place where you don't talk about racism. Racism does not exist. I was ashamed of telling anybody about that. I had to go to the bathroom and cry. I didn't talk to anybody about that because I feel like, is this something that I am projecting? Is this real? Could this be real? Is this what's happening here? I didn't talk about it. I just left it. And subsequently, some other person came. I was in front there. I was a child nurse. And then I had some other staffs that they were there. I was the only person of color, the only black person there. So this person said, can I talk to the RN? The other girl said, that is the RN. She said, no, I mean, can I talk to the child nurse? She said, that's the child nurse. And she actually talked over me. Like I was there, standing there. She didn't acknowledge my presence. She was asking the girls by the healthcare aides. She was asking them questions about, I think that was her mom. She was asking them questions about her mom. I felt so uncomfortable. And at the same time, it came down to the same thing. I could not make sense of it because my belief was that this is that you don't talk about it. I was like, am I being too sensitive? But this is actually too much too. So what actually happened was I didn't talk about it. I didn't make any, but I started internalizing that. And over time, it began to build up, right? And that was when I started seeing some other things like stereotypical biases. Like people will treat me differently from the way they will treat other people, and people will answer questions to me differently, or they even talk to me differently, and then and some other microaggressions and passive aggressive behaviors. So I said, okay, could this be me? Is there something I'm doing wrong? Is there something happening here? And that was when I started reaching out to other black nurses like me. And that was when I had my aha moment, right? As I was talking to people, interestingly, I saw my experience in their story. The only difference was they had a different name. I had a different. It was just the same thing. And what was so astonishing was that we all had the same thing, like doubt. Could this be me? Is it me that is projecting this? How come nobody is talking? Because nobody talked about it. Nobody was talking about it. We were all kind of, bottling this stuff. It was actually, and remember, it wasn't a group. Like one person, I will call this person and I will say, oh, look at this happen. I don't know. She would say, oh, that happened to me how many years ago? And it's still happening. I'll be like, really? Okay, I'll drop the phone. I will think about it. I was like, this is not even happening. So some other thing will happen. I was okay, let me check in with this other person and see how, like in different places, different provinces. I will call and she'll say, oh my goodness, that is normal. That's happened. Like, that just ignore it. Just try to be normal. Just try to be. I said, no, like it is difficult to act normal around here. And that was actually when I conceived the thought to form an informal support group. That's the Nigerian Canadian Nurses Association. It was from my experience and my story that I was like, okay, if I can help the younger ones or any other person of color that is a nurse, an immigrant nurse coming, to be able to know that these things, they're not a problem. Of course, we all have learning curve. We all have to strive towards excellence. We all have to learn. But at the same time, these things are not you, right? Like there are people that these things have happened to, and we can all learn from our collective stories. We can all improve and help support ourselves psychologically, emotionally, and then look for educational resources to help us. So that's when we started having annual conferences where we get speakers like senior nurses who are well versed and who are well read to come and talk to us. And surprisingly, they share their own experience, and maybe like 10, 20 years ago. And it's the same thing today, but nobody talked about it. So yeah, that's it's been really a journey.
Well, I think that there's lots of concerns. I think that a lot of young people, young black people, are looking for a sense of direction. And they may get that from their community, but they may also not get that because their parents often, in many cases, are working hard to support them. And so they're kind of left to their own devices. And again, so now we're educated about how we should behave from pop culture, which unfortunately gives us the wrong message. And there's not enough, in my opinion, not enough black leadership to help show these young people something different. And I like to go back and talk about the importance of that, because I think it's our responsibility to make sure that we are providing another way or another thing for black people to see. Yeah, well, this stuff gets handed down. So parents have trauma, and so that's going to impact the way that they interact with their children, and that's going to have an influence on their behavior. Or children who have witnessed violence or been victimized by violence, it's going to impact the way that they behave. And unfortunately, many of the systems that are set up in place are not addressing the underlying mental health issue, and rather they're just addressing the behavior. And so what that does is it further stigmatizes these young people to a place of, this is a bad youth, or this person gets into trouble, or this is a troublemaker, or they're going to go to CYOC, where I historically worked. So we further stigmatize them because of their trauma, when really we should be trying to address the underlying trauma and help the system, that whole family system, to heal so that they can move forward in a successful way. Yeah, I think first of it is education. So people have to understand what these young people bring to the table and why. I think that we need more people who are knowledgeable, not only about trauma, but about the trauma as it relates to people of color. And I think that we missed the mark there. So I'll give you an example. And there might be, I'm going to preface this with this, all these people that I was in a training with were probably very, very smart and very educated. But I was in a training maybe a month ago, and in that training, there was maybe 40 or 50 individuals, and there was only 3 people of color in that training, and only 1 male of color. And so I'm not saying that somebody who's Caucasian can't understand the plight of somebody who's come to our country from a war-torn place, or the struggles of what it means to be black in Canada or North America. But I think that it's really useful for people who are of color to be able to connect with somebody that looks like them. They can say, okay, maybe this person understands where I'm coming from, right? One of the interesting lessons that I learned was when I worked at a local agency here in town, and we used to do work with indigenous populations, people, and so I had the opportunity to travel to Maine, which is like one of the farthest northeastern settlements in all of Canada. And the thing that I learned is that we were trying to do this work here in Calgary and giving people the message like, oh, if you go to school, life's going to be okay. If you follow A, B, and C, things are going to be okay. And then I went back to the community and realized very quickly that that's not the case. So we're teaching them how to behave in one certain context that doesn't relate to their context elsewhere. And so I think that fits with what's happening even in Calgary, is that we go to school and we say, okay, if you do this, you learn this math, you do this, life's going to be okay. You're going to be successful. But that's not necessarily the truth, because we're not arming these young people with the tools that they need to be successful. They're going to be going back to the same environment that they came from, and some of that relates to drugs, some of that relates to gang involvement, some of that relates to parents who have language barriers. They don't understand how the system works, and so they're not going to be they're not going to have the advantages as people that are maybe were born here or their Caucasian peers, right?
I think it's very important because everybody who will be there, government, child advocacy office, social workers, professionals, the police, everybody, it's an opportunity for us to tell them who we are, to tell them we are colorful people, we are loving, we are kind, we are compassionate. It's also an opportunity for us to tell them how we want them to support us. Because if I don't tell you how I want you to support me, you wouldn't know what I need. It's a way for us to be able to, talk about our needs. Because even in coming here, I tried to look at some statistics. It discovered that the income of an average immigrant who is non-black is about $50,000 a year. But for a black immigrant, it's about $35,000 a year. And even in the research done by the police in 2018, the police even confirmed that black people are likely to be victims of hate crimes. And then when it comes to education, about 94% of black young people say they would like to get some college education. But how many of them actually get it? Maybe about 60%, which is far, far lower than, people of non-visible minority. So it's really hard. And I think it's high time we cry out because we need that support. What I would like them to take away is it's high time we step out of our comfort zone and reach out to somebody. Reach out to the youths, reach out to families, reach out to black people, and not sit back and watch. Because this is our city. Most times when things happen in the Southeast, we say, oh, I live in the Southwest, so it's a Southeast problem. No, it's our city problem.
As a mother, right, and as a black woman, I worry for my own. I have kids, right? I worry about them a lot. I worry about them when they are in school. I worry that if they do something, that they may not be treated with the same level of. They may actually face bigger and more severe consequences than the regular child. So I cannot really speak so much about what this youth might be going through, but this has actually been is an area that is well researched, that discrimination do exist, and systemic racism, that is why it is systemic. It cuts across every level of the institution. And when we talk about institution, we're talking about schools, we're talking about hospitals, clinics, we're talking about policies, right? And then when you sieve it down, it comes down to internalized stereotypes. So like if I'm biased in any way, and I'm since a person of color, I have to see the person first from the screen through which I'm looking at, right? So the tendency of treating that person differently is there without me even knowing it. You see what I'm trying to say? So that's and that's a big problem. But the bigger problem with Canadian systemic racism is that there's not a lot of data to back it up. Why? Because we don't talk about it here, right? And because that we don't talk about it does not mean it does not exist. If you want to hear about racism, stereotypical biases, cultural biases, talk to the people that are going through it. And what I have learned over the years of talking to people informally, every day I can tell you that every week at least I talk to somebody that is going through this process. Every week, it's like constant. So one thing that is the common denominator among all of these experiences is that they come up feeling, is it just me, right? Why is it that, am I targeted? Did I do something wrong? Is it so? Because it's almost like if you talk about it, you're being too sensitive. If you talk about it, you are projecting something inferior. So like people always want to, they are always not, there's not a safe place to talk about it. And when you talk about the research here in Canada about effects of racism on Black, it is very scant. So that's even like a major challenge.
For me, I've had lots of advantages, and so I don't know if I can compare my situation to somebody else's. Obviously, I had to work hard, and I had people in my corner that were supportive. So I had some advantages that our young people don't. For me, I feel like it's an advantage because I'm a minority working as a psychologist, and there's very few within the city, probably very few within the province, and so I think it's provided me with some opportunities, and I also have a sports background and some of these other things. So, yeah, for me, it's been an advantage for sure. I had a unique opportunity to travel overseas with my dad when he worked for the Canadian government. And so during that, prior to us leaving, we had to go through like a cultural sensitivity training. And I might have been grade 6, so what does that make it? 10, 11, something like that. And in that presentation, they presented me with all these scenarios, right? They told stories about people kind of skipping around a room in white uniforms with big white hats and poking people with sticks, and I was like, oh, that's so weird. So they provide you with all these different scenarios, and then they say, actually, that is what's happening here. And it kind of gave me a different perspective about my biases and how I looked at things, even at a really young age. And so I think about those experiences now when I'm older, as when somebody's telling me a story, to make sure that I'm taking my own personal bias out of it, because there could be more to the story. There could be other ways that can present itself, or the cultural things that play into that. And so I think the most important thing is just listening, making sure you're an active listener, and making sure that you are able to think about the personal biases that you might be bringing to the table with whomever.
From my experience, like I said, so a lot of people going through these issues of racism, and to be honest, discrimination is not a small thing. It is not a small joke for the person that's going through it. It impacts them physiologically. What I mean for that, people are sick. People are physically, because of the prolonged effect of the hormones. People are physically sick. They have headaches, they have migraines, they're sick physically, right? It impacts them psychologically. Like, people begin to think they're crazy. They go depression, like so many other things. And then behaviorally, like people begin to take on the maladaptive process, like drinking, stuff like that. So all of those things, they impact people. So discrimination, it has been proven over and over again that it's bad for people's health. It is detrimental to the root of it. Okay. So, and if we cannot solve a problem we don't know. For us to solve a problem, we need to identify it properly. And the way to identify it is to hold space. Hold space where people can listen non-defensively. The people will always, oh, I'm not a racist. To be honest, all of us are biased. All of us, we are biased. And if we don't listen, I won't know what I'm doing wrong. Okay, I wouldn't know, what I'm doing now is microaggression. What I'm doing now is passive aggression, and it's impacting somebody, right? That's some of the wide privileges that I see around, right? So people don't feel like, oh, I am not part of the problem. So we are all part of the problem. So we have to hold space so that people that are going through these experiences, they can actually feel safe to talk about it. So government, institutions, they can institute policies and make it easier for people to come forward with this kind of complaints, with this kind of challenges, without feeling like they are overreacting or they're acting or they're being too sensitive. So, and culturally, in our own culture, talking about mental health is not an easy topic, right? it's not easy. Just the same way as talking about divorce, it's not an easy topic. It's a very sensitive topic. So I think one of the easiest things we can do is to continue to create awareness. Like, and then that's something I am going to come somewhere with this. My 5-year-old daughter, when she was 5 years, she came to me and said, "Mom, why is it that my skin is black and every other person is white?" I tried. It was a whole journey of trying to get her to understand that. And then after 2 months, she came back and said, Mom, if we say that we're all the same, it doesn't matter the race. Why is that my teacher is white? Everybody, my school driver is white. Every other person is white." So for her, seeing that these are the people she holds high, right? So seeing that the people she respects and holds high are white, it is difficult to tell her that is not a higher race. you get what I'm saying. So if we can find a way to increase diversity, like make these professionals like so that when people are they find it more comfortable talking to people that look like them because they feel like you can understand their story, you can understand their background. Like they're not being judged, right? They're not going to. It is not like you're going to say, "Oh, that's just not validate their feelings or not validate what they're saying," and finding a way to integrate mental health into our culture. Like our people, we are strong people of faith, and we value culture, we value traditions. Right? Okay, bringing some of these things to church groups, to youth groups, bringing it to them so that when it's kind of closed down, people tend to trust something that looks more like them.
Yeah, I think the way that you help people to get where they need to get is to educate them. And so the more we can educate people about what's actually going on and how these difficult things that are happening in these young people's lives are impacting them, the better we can get or the closer we can get to making equity. We have an opportunity now to have our voices heard, and so we need to make sure that people who have the ability to articulate themselves in a strong way do that, step forward and become the leaders that we need. And young people, they have the opportunity, with people listening, to have their voice heard as well. And so we just have to try and do it in the right way, even though there might be pressures to do it in the wrong way. But we have to continue to try and present ourselves in a way that really speaks the message so people hear what we're actually trying to say rather than let the noise filter in.
This is one of the most important avenues, okay, to reach out to the youth and Black families that are very far gone, and especially that is located within the Center for Newcomers, right? This is a place like people that do not know where to go to, people that do not know where to get the information. So they're coming here, they're getting the right information. So it's actually a resource that is catering to the right people, right? It is catering to the mental health of youths, of parents from Africa, and it's actually suited, like it kind of mirrors and fits into their culture, so they're more likely to accept it. People challenge their thoughts, and that is because people do not validate what they feel, what they go through. And when you deny somebody's, for instance, if I tell you, "Oh, I am seeing black here," right? And you're telling me, "Oh, that's not black, that's white." You know what? That is gaslighting. That is you are actually is a form of mental abuse. And if you do that over to me over and over, I begin to think maybe that's not even black, maybe that's even white. And what does that do? It's a huge form of psychological abuse. Over time, people begin to lose their mind. Okay, so what I can say is this: the last thing I can say, people that are going through this, it's okay to talk about it. You can find a support person to share these things with. That is for people that are going through these forms of experiences, and for the bigger systems, hold space, make it easier for people to come forward and talk about it without feeling like they are projecting their own insecurity.
What I would like to add is that one, we need to look at all the sectors of the economy. Looking at education, we have a lot of our kids in elementary schools, in high schools, even in colleges. I believe that the recruitment process of teachers, of instructors at all levels need to reflect that diversity. Because a Black man who is a teacher in elementary, not only is a teacher, he's also there as a mentor. Because a Black kid is not going to go to another teacher who is not Black to say, "Sir, I'm struggling." No. So we need to reflect that diversity in our education. And then concerning our universities and colleges, I think the government needs to put in a lot of funding into research and conferences that will be able to look at racism and look at the impact of racism in our economy, in our society. That's for education. Then in mental health, it's high time we start looking at the mental health of the Black population, because it's very, very key. And we are seeing a lot of that out there. Those of us in mental health field, we're seeing a lot of it out there. Because sometimes you have a black person call you and say, "Oh, I've been looking for a black psychologist. I just found you this morning." You know, and then when they come in, I spend the first 5 minutes trying to educate, to say, we are all trained, we are licensed by the same college, we all have compassion for the work we do. It doesn't matter the color, it doesn't matter the race, just go, somebody will help you. But culturally, they don't want to do that, right? So mental health is very, very key as well. Then within the justice system, it's high time we start looking at crime from the trauma lens. If a black little boy goes to steal food from Walmart, yes, arrest him, but ask him while you're taking him to the car and say, "Son, have you had breakfast?" Because that boy may have gone to steal because he hasn't eaten all day. He hasn't eaten the day before. Okay, so more like being sensitive to what we're doing and looking at things with the eyes of trauma as well. Yeah, and then collaboration is key. Let's collaborate in our neighborhoods, within our area. Let's find something to do together to support one another. Collaboration is key. We need mentors. We need people that will support black people. We need people that will, even in the work I do, there are you will see some white young boys who need mentors. There are no fathers in their lives. There is nothing wrong with a black man mentoring a white kid. What are we doing? We are raising the next generation, and that is what is really key. So collaboration is very key. Mentoring is very key. Let's stop running. Let's stop running away from each other. Together we can go to the next level. Look at COVID. COVID doesn't know whether the surface I touch was previously touched by a black person or a white person. No. What COVID knows is that I've touched a surface and I put it on my face, I get COVID, right? You can see how the thing spread. And this is in line with what, the Cree, the indigenous people, that's a word I love from their language. From the Cree language is Watankwen. Watankwen means whatever we say, wherever we go, whoever we meet, there's a connection between all of us. And the truth is that whether we are black, white, Latino, Asian, Indian, we are all connected. And that's what I have to say. So let's focus on one another. Let's help one another. Because people will definitely remember the way you made them feel. They may not remember what you did, but they'll remember what you made them feel. Yeah.